Hi, my name is Catherine Price. I'm a physical therapist. Today I'm going to go over 2 evidence-based exercises that address SI joint pain. Please consult your medical doctor or physical therapist for the appropriateness of exercises for you. Before I begin, I'd like to read a scripture, 2 Timothy chapter 4, verse 16 through 18. At my first offense, no one came to my support, but everyone deserted me. May it not be held against them. But the Lord stood at my side and gave me strength, so that through me the message might be fully proclaimed, and all the Gentiles might hear it. And I was delivered from the lion's mouth. The Lord will rescue me from every evil attack and will bring me safely to his heavenly kingdom. To him be glory forever and ever. Amen. So the SI joint is at the bottom of the spine, and so some people may describe it as low back pain, and I'm going to pinpoint exactly where this pain usually occurs. So if you are feeling the back of your hips, that bone on both sides, if you have pinpoint pain there, or there's where your localized pain is, that could be SI joint related. The ligaments in the body, that is the connective tissue that connects bone to bone, and those ligaments can be sprained, and that can be chronic. They can be sprained for a number of reasons: leg imbalance, stepping off of a curve, having a fall hard on your bottom. So these ligaments can be affected from everyday occurrences. And these are 2 exercises that are evidence-based. There's been years of research to go into addressing this pain. And if you are having pain in that area, don't expect quick results. Sometimes there are quick results, but if it's been there for a long time, if you can continue with the exercises for about 6 weeks, you can see if these will be helpful for you. So to begin, I am going to first tell you what I'm going to be using. I am going to use a balloon. You do not have to, but it is a good way to get some resistance when you're trying to breathe. I'm going to use a TheraBand and then a small ball. You can use a pillow. So these are what I will start with. You want to be up against a wall. This is going to be my makeshift wall. I'm going to be on my left side. And you're only going to do them as I instruct you. It is going to seem imbalanced from side to side, but it's very specific muscles that you are going to be contracting on one side of the body versus the other. And I will go through and describe those. So you want to be on your left side. I'm going to take the balloon and place it in my right hand. I want to elevate my legs, so I'm going to use a pillow up against the wall. I want my knees to be in a 90-degree position, so I'm going to bend 90-degree angle here. And I want my toes on the wall. I'm going to lie down. It's important that I keep my neck and my shoulders relaxed. So the first thing I'm going to do is I'm going to engage my abdominals by bringing my navel to my spine. So I'm going to tighten my abdominals. That's going to round out my back slightly. After I round out my back, tighten my tummy, you can press your left hip down into the floor. When you do that, your right knee shifts forward. So you're shifting your right knee over the left knee, and then you're going to take that right knee, you're going to push your foot into the wall, rotate that knee up towards the ceiling, and then lift the bottom leg. My balloon is going to be in my right hand. My upper body is going to be completely relaxed. So I should feel my buttocks working on the right side, my inner thigh on the left. My abdominals are going to be contracted. There's a lot going on in this position. And then I'm going to take 4 deep breaths, breathing in through my nose, out through my mouth, using the balloon. Then I'm going to just let everything go, relax, let the air out of my balloon, and take a rest. I'm going to talk through it again. I'm going to tighten my tummy, round out my back. I'm gonna shift my right knee over my left. I can push my left hip down into the floor towards the wall, and my right knee's gonna shift forward. Then I'm gonna use my right buttocks to pull that knee up towards the ceiling, and then I'm gonna use the inner thigh on the left to lift my left knee towards the other knee. I'm gonna hold this position and blow up the balloon. The neck and the shoulders should be as relaxed as possible, completely relaxed. Pinching off my balloon, letting everything go, and the air goes out of the balloon. So I want to do this about 4 or 5 times. So I'm going to go through this 2 more times. I've got my feet, my toes up on the wall. I'm going to shift my right knee over my left knee. I'm going to rotate the right knee towards the ceiling, feeling my buttocks turning on, lifting my left knee up towards the other knee, keeping my neck and shoulders relaxed. My abdominals are tight, holding this position. Pinching off the balloon, letting everything relax, and the air out of the balloon. Now this is going to address both right and left SI joint. This is the one I would go to if my right side were hurting. So even though it addresses both sides, this is going to be what I would use if my right side were hurting me. So starting again, I'm going to tighten my abdominals, rounding out my back. I'm going to shift the right knee over the left knee, pivot off of that right foot, pushing my right toe into the wall, feeling my right buttocks turning on, then lifting my left knee up towards the right knee. I'm going to hold this position and blow up the balloon. Pinching off the balloon, then letting everything go, letting the air out, and that completes the first exercise. Now the next exercise I'm going to show from different directions so that you can see it. This again is for both that left and right SI joint pain. If I'm having left SI problems, this is the exercise that I would start with, even though it's treating both. So I'm going to bring my feet on a 2-inch surface. So you can use a block, you can use a pillow. You just want your feet to be up. I'm going to take my band, place it around my ankle. I'm going to use either a pillow or a small ball just to place it between my knees. And then I'm going to lie onto my back. So the first thing I want to do is the same thing I did before. I'm going to bring my navel into my spine, so I'm turning on my abdominals. I'm going to tilt my tailbone slightly off the floor, but I'm not going to lift my bottom. That's not what we're going for. We want to turn off the back by turning on the abdominals. So I just want to bring my navel to my spine, only contracting the core, the front, and I'm going to hold that. Then I'm going to take my left knee and pull it towards my left hip. When I pull down into that hip, and then press into the ball with my left knee, I'm going to feel the inner thigh working on the left side. I'm then going to push down into my right foot to feel my right buttocks turn on. I'm going to lift my left foot and then turn it out to the side. And I'm going to hold that position. So this is probably going to do better if you see me from this direction. And so I'm going to place my feet on the pillow, and I'm going to go onto my back. I'm going to place the small ball between my knees. So when I'm here, I'm going to bring my navel to my spine, rounding, lifting my tailbone off the floor, but not lifting my back. So I'm just lifting the tailbone off the floor. When I take my left knee, I'm gonna pull it towards that hip. You should see it, the right knee peeking out above. I'm still gonna keep my core contracted. Now I'm gonna press my left knee into the ball. I'm gonna feel the inner thigh working. Pushing down with my right foot, I'm gonna lift the left leg up, turn it out to the side, and then I'm gonna take 4 deep breaths, in and out, in through my nose, and then out through my mouth. And then relax so that you can see this from a different angle. I'm going to take my feet, place it on top of the pillow. I'm going to have a ball between my knees, a band around my ankle. I'm going to bring my navel into my spine. I'm going to draw my abdominals inward. That's going to tilt my tailbone slightly off the floor. Take my left knee. I'm going to pull it towards my hip, pressing the knee into the ball to feel the inner thigh working on the left side. Push down with my right foot, turn that left foot out to the side, and then take 4 deep breaths in and then out. So deep breath in, all the way out. Deep breath in, all the way out. Deep breath in, all the way out. Deep breath in, and all the way out. Then I'll show you from the front. So the other part is you want to bring the right arm over your head. That opens up the right lung, the right side. We have a heavy liver on the right side of our body. That's the rationale for that. I'm going to place my feet up onto the pillow. I've got a band around my ankle, ball between my knee. I'm going to be onto my back. I want to tighten my abdominals so that I'm bringing my tail off the floor. I'm going to take that left knee, pull it into that hip, pressing the left knee into the ball. I'm going to push down on the right foot, lifting the left leg out to the side, and then right arm is over my head, taking a deep breath in through my nose, out through my mouth, in through my nose, and then bring everything down and relax. And what is happening when I'm turning that left foot out, I'm engaging the left gluteus medius. So we're activating your right buttocks, your abdominals, your left adductor magnus, and your left glute medius. These are important muscles to activate in order to reduce the ligament strain on the SI joint. I'm going to do one more of these, and I'm going to show you from this direction. So I've got my feet on elevated about 2 inches, ball between my knees, a band around my ankle. I'm going to bring my right arm over my head. I want to engage my abdominals, tilting my tailbone off the floor, pulling that left knee towards the left hip, pressing the knee into the ball, lifting the left foot, turning it out to the side, and then taking 4 deep breaths in and then all the way out. And then relaxing down. So those are 2 evidence-based exercises to address SI joint pain. They address both right and left side. The first one, again, I would do if I was having right-sided pain, and then if I were having left-sided SI joint pain, I would do the exercise that I just showed you. I hope that you have a blessed day. Thank you.